So the question is, what if my sleeve has failed, or what if I have failed my sleeve? What are my options? So the options today for a failed sleeve procedure are several. But first of all, I would just like to say that I don't really like to use the word failed sleeve. I think all of these interventions are imperfect. And just keep in mind, we have some things we can control, like how diligent we are with our exercise regimen and our diet and the procedure that's been done. But there are things that are out of our control, like our genes and some of the metabolic programming that we are all battling against to keep weight off. So we know that the results of the sleeve are not the same universally for every single person. So some people may find that the sleeve results in insufficient weight loss, or they may lose a lot of weight, but over the years regain weight. And some of this may be under our control, but much of it may not be under our control. The question is, if that's happened, if we have inadequate weight loss or recurrent obesity or recurrent weight gain, or just a return of diabetes, what are the options? Are there any options? And the good news with the sleeve is that there are several good options, and I'll describe the one that I think may be the best option. But one thing to keep in mind is that the sleeve is very versatile. It's simply a reduction in the size of the stomach. So one has not burned any bridges. You have not had a big major bypass that's difficult to undo, nor is there any foreign body implanted that has to be taken out. It's simply that the stomach is smaller. So when a person comes to me with the question of, Doc, what do I do now if I regained weight and had a sleeve 8 years ago? The answer is that we can do a procedure that will result in a large degree of weight loss and a high likelihood of resolving diabetes with a 1 hour or less laparoscopy with a very low risk. There are a couple of different procedures. The first one is a type of bypass that's referred to as a duodenoileostomy, meaning just past the stomach, past what's called the pylorus. The duodenum is connected to the ileum. And this used to be called a duodenal switch procedure or a duodenoileostomy procedure. And nowadays we do this with the laparoscopy, so the 5 small incisions, usually an overnight stay, often a 45-minute procedure. And we do see excellent weight loss results and improvement in metabolism and diabetes as a result. Other people still advocate conversion to a gastric bypass procedure. And this would just simply connect to the stomach sleeve, just like we had done with traditional gastric bypass operations. And while the data are mixed on the magnitude of success with gastric bypass, certainly for most people it does result in some success. So in the years to come, we will see bigger studies showing longer-term results with these interventions. But suffice it to say that there are excellent interventions that are not very invasive and are generally very successful at creating new weight loss and new improvements in metabolism and diabetes with a laparoscopy, with low invasiveness, without a foreign body implant, and good success. So talk to your surgeon about the options and know that there are some good ones out there.